Welcome to the Suturing and Surgical Skills Clinic. My name is Christian Asher and I'm going to be your host. We're going to be covering some essential skills for suturing. It's going to be interrupted sutures, tips and tricks on how to retension your knot, mattress suture, different variations, why we like to use it, and then if we've got some time, we'll do the subcuticular as well. This is our first live video. Feel free to leave comments and watch it back. Let us know what you think. The skin pad is by my Suture. Got a 10% discount code which we'll post in the description. Let's see. If we can turn this around. So, talking about the needle holder and how to hold things. So we've got ring finger, thumb in the rings, middle finger is on this angle here to give yourself support and help yourself unlock the ratchet. The ratchet is this point here. Your index finger is used for stability. So there's two ways of holding the needle holder. The first is to mount like so. The second is to palm it. To palm your needle holder, your grip is between index finger and thumb. And you just rotate. And then when you want to unlock the ratchet, you've rotated your wrist, you put your ring finger in, then your thumb, and unlock. In terms of suturing, you're going to have forceps in one hand, needle holder in the other, and you're working together. So let's do an interrupted stitch. So I'm just taking out this monofilament suture. It has a bit of memory to it, so I'm going to take it out by holding the top end by the needle and stretching it out. and then the suture becomes straight like that. So, talking about interrupted suture. So the key thing to suturing is don't pinch the skin. You don't want to leave impressions. You want to go in at 90 degrees, so not with the point of the needle underneath like this. You're just going to go like this and rotate. Grab the needle with your forceps, mount it straight away if you need to continue. Don't put the instruments down, keep them in your web space. And you can just pull with one hand, like so and like so and like so. And then you keep a short end and a long end. For interrupted suturing, you lay your needle holder parallel to the wound and you wrap the long thread around the tips of the needle holder, not the body, towards the short. Just do that again. 1, 2. And then you do the same. The short end and the long end have to alternate in position. Put your instruments together. I zoom out a little bit. So I'm holding everything in my left hand. I get my scissor and I can cut for myself. Let's do that again with a trick on how to tighten your knot, because I don't know if you noticed, but my knot loosened as I tied that. So we're here. We pull, wrap around the tips, tighten your knot. If your knot's going to loosen like that, what you can do is tighten your knot, slide the knot to one side, and it holds it. Just don't unravel it when you tie it. I've done it a bit now, so I'll do that again. 1, 2. Then bring everything to one hand and cut. Next way I'm going to show you is if I palm the instrument. So with my fingers, like so. You do this when you're kind of suturing at depth. So I'm through here, and I want to put my fingers inside. So my ring finger goes in, my thumb goes in. I unlock the ratchet, and I just redirect, because I'm not all the way through. When you grab your needle, there's some few key things you need to do. I'll go through that in a second. We'll talk about needle nomenclature or naming as such, if we're going to name different parts of the suture. So we have our suture here. It has different points. You have the point, which is the sharp bit. You have the body, and then the swage, where the thread attaches. Don't grab the needle at the point. Don't grab it at the swage. If you grab it at the point, it won't pass through because you'll blunt it. If you grab it at the swage, you'll pull out the suture. You want to mount it 2/3 along the body, which we'll do now. So that you just have to follow a gentle curve. We'll do one more bite, and we'll do another little trick on how to retension a loose knot. That's going to be a slip knot. So 1, 2, this is a surgeon's knot. If your wound gapes like that, then you're going to go around, grab the short suture, let everything go back to where it just came from. So the short suture was here, the long suture was here. Pull just the short suture. I can see that the wound is now approximated. So now I pull both. And that's a slip knot. So when you don't alternate the position of the long and the short end, your knot is not secure, but it means that you can retension the knot. I'll do that one more time. Just mount this properly. So we said we're going to do a mattress suture after this. We'll do a mattress and a couple of variations, just as a bonus. 1, 2. Tighten it. 1. Oh, so we're going to slip it, didn't we? So your wound has reopened for whatever reason, it's under tension. So to retension it, normally your short end and long end would alternate. So for the next one, if I was doing a correct reef knot, the short end would come here, the long end would come down here. Because my wound is open, I'm going to retension the knot. To do that, I'm going to bring the short end back down and the long end back up. Short end comes down, the knot tightens, the wound closes, and voila. And then you do your last knot. And then you cut. So the last thing to cover today is the horizontal mattress. So the horizontal mattress is a good suture for wound eversion. It's also a good technique for demonstrating how to be a bit more efficient with your needle mounting, I suppose. I need to turn the needle around, and then you take a bite adjacent to your second exit point. This needle is a short needle, so I can't pull it through in one and pull it across the other side in one, so I have to do it in two. I'm going to show you my hand in the position it's in to do a backhand bite. And it's like this. Push it through a bit more. When I do my horizontal mattress, I don't let the loop go all the way in until I'm tying the knot. Because if you let it go all the way in before, when you tie a knot, it will strangulate the tissue. So I'll try and zoom in on this. I'll do a couple and I'll show you how it everts the wound edges a bit more than a simple interrupted. Let's do one here. So you go standard, bite across the wound. I'm changing my grip and turning the needle around. If you do that technique, just make sure you reverse it on a patch of skin that's got local anesthesia or the patient's already asleep. So somewhere near the wound edge, really. Short end and the long end. I don't let it go all the way in, but if you do, it's not too big a problem. 2 revolutions. There it goes. And there you cut. So when you've got lots of cutting to do, palm the scissor. This is a really good trick I like. Ring finger and thumb. You take out your thumb when you finish cutting, and with your index finger, push the scissor down towards the palm of your hand, like so. To carry on suturing, you just put the needle holder on top, and you carry on, like so. So it's like that and like that. When I'm done, I pass the instruments all to one hand. I flick out the scissor, I cut, and then I flick it back down, like so. Alright, so let's do a quick summary of both the sutures we have just done. So I'm going to take out another suture. When you take out sutures from a packet, mount the needle, pull the packet away and keep the suture within your direct vision. So the first suture we did was the interrupted. We covered how to hold the suture, the needle holder. There's 2 grips, fingers mounted like this. Unlock the ratchet by counter traction, or the palm grip like this. And it's always a rotationary movement. Once you've done the rotation, ring finger, thumb, unlock the ratchet. So we talked about the needle. You've got the point, the body, and the swage. The point is the sharp bit that goes through the skin. And if you grab the point at this point, you blunt it. If you grab the swage where the thread inserts onto the needle, you'll disengage the suture. So you try to mount it 2/3 along the body. You enter at 90 degrees, not flat, 90 degrees. You don't really need to hold the skin, you just need to look back to see your depth. If you can go across in 1, great. If you can't, do it in 2. We did how to retension or retighten your knot. So this is a surgeon's knot, 2 revolutions around the needle holder, 1, 2. If it gapes, option 1, you pull your suture ends, you slide your knot to one side. That didn't work, so I'm going to do a slip knot. I'm going to let the short end come back to where it came from. The wound is now closed, so I pull the long end. And then carry on. So 2 techniques in tightening your knot. We covered, if we've got lots of suturing to do, palming the scissors. And then now for the horizontal mattress. So we go straight across. We need to reverse the needle in an area that's got anesthetic in. Pull the suture through and then go back into the hand. I'll show you how I palm the instrument. So this is the grip I've got for that. Fingers aren't in the needle holder, just so I can suture backhand. I've now mounted my fingers into the needle holder. And there we are. When I do my horizontal mattress, I don't let the loop go all the way into the skin, because when you tie the knot, it will go all the way into the skin, so I don't want to strangulate it too much. Myself more length. Keep everything within your surgical field where you're operating. So 1, 2, that's a surgeon's knot. It's loosened, so I'm going to do a slip knot by pulling the short end back to where it came from. When it's got to where I want it to, I tension it again. Suturing just requires you to have control. There's lots of different tricks. And then I said I would show you the eversion. So if you look at the interrupted, the edges are approximated, but it's flat, whereas you can see that this has got a bit of a hill to it, it's puckered. So this is useful because if you've got lots of local anesthetic in and you're dealing with trauma, often in trauma with, say, a blunt force trauma, such as a laceration, which is what a blunt force trauma is, the edges will invert or bevel in. Or let's say they've had an incisional wound and one side's overhanging. If the wound edges are inside, you'll have epidermis to dermis and dermis to epidermis. The wound will not heal. So the horizontal mattress is good for eversion, so that you have dermis to dermis and epidermis to epidermis, which will allow the wound to heal. If you've got dermis to epidermis, the wound will never heal, or it will take longer. The longer a wound takes to heal, the longer the inflammatory phase continues, the more likely you are to get a keloid scar. And I said I would teach you one more variation of the horizontal mattress. So we're going to do the locking mattress. The locking horizontal mattress is an excellent suture for wounds under tension. By wounds under tension, I mean gaping wounds. So this is a more gaping wound than this wound. In an ideal world, you put a deep dermal in. For whatever reason, you can't, or you're not going to, so do a locking horizontal mattress. Starts the same as an interrupted. Pull the suture through. Just palm my needle holder, turn the needle around, taking the bite adjacent to my second exit point. Here we are. Put it through. So to make it locking, you pass the needle through the loop. And this is a useful suture under tension because, as I showed you, that loop goes into the skin. If it's under tension, it's going to get buried in the skin. So to help keep that loop out and to take the tension off of the skin edges, this suture, this one, will lift the loop out. We're trying to keep tension off the skin edges because if you keep tension on the skin edges, you get skin edge necrosis. As you can see, so it distributes tension more evenly. As you can see, it's pulling the skin pad up from the corner, suggesting that it's pulling the tension over a large area. So I did my holding knot by sliding the short suture up. And there we go. I'm going to do that one more time. Then that will bring today's suturing and surgical skills clinic to a close. If you would like to join us in 8 minutes for the extended session, which is going to be 10 minutes of a few extra tips and tricks, you are more than welcome to join and become a member. There should be a link on the main page. So we're going to reverse this. Oh yeah, I love it when that works. Now, many people don't like the reversal on the skin because they damage the skin, but you have control of your needle and it doesn't leave stitch marks because I'm not pressing the point of the needle into the skin. I'm simply using the skin to turn the needle. And people say you don't need to do that, it's not necessary. Sometimes you're operating alone, you're holding the limb yourself with your one hand, you haven't got a free hand to put the forceps down, so you just need to reverse it in a quick, easy fashion, and on the edge of where you're working is often an easy way, under controlled applied pressure. So the locking horizontal mattress, so this is the horizontal mattress, started here, came out here, went in next to it, came out here. I'm going to put the suture through the loop, or the needle through the loop rather. And I use this for wounds under tension because it distributes it more evenly across the wound, spreading it over a larger area, keeping the loop from digging, the sutures from digging into the tissues, reducing the risk of skin edge necrosis by compromising the dermal blood supply. Because it's under tension, it gapes. So the other way of doing things is to make it a slip knot. Before I showed you, I can slide the knot like so, and that locks it. The other option is to slip it, which means the short end will come back down here, the long end will go back up there. So now the wound is closed. I'm going to tighten it by pulling here. Yes, and palming the needle, hold the scissors, take your thumb out, flick it down, and you're like this. And that brings this session to an end. Like I said, I'm going to go to the extended session now in 5 minutes for some bonus tips and tricks. Without any further ado, we'll see you next time. Feel free to watch the replay. Take care.